Well, tonight, a former state health leader is warning Louisiana's abortion law could be negatively impacting the way doctors treat their patients. Well, she says the issue is not about being pro-life or even being pro-choice, but as Eleanor Tabone explains, some doctors say the law is leaving them in limbo.
Dr. Rebekah Gee is an OB/GYN and the former secretary of the Louisiana Department of Health. Now the CEO of Nest Health, the mother of 5, submitted an affidavit supporting a halt on Louisiana's abortion law. Her concerns are for the health of women and practicing physicians. Louisiana's abortion law allows for abortions if the life of the mother is at risk. Dr. Gee says that leaves a lot of grey area.
When is it enough to intervene? What if she's going to lose her lungs, her liver, her heart? What if she's going to lose her kidney? What if she's going to lose her fertility? At what point does the sum of the parts of a woman add up to her life?
Dr. Gee says a third of pregnancies end in miscarriages. Louisiana, the second highest state for maternal mortality rates. She says the most common medical emergency during pregnancy is hemorrhaging.
At what point is it okay to intervene, to stop the bleeding, to end the pregnancy, to save her life?
She says medical professionals aren't being given any guidance on how to proceed with routine care.
Do we have to set up, a room outside of the emergency room for the individuals who legislated this to come and watch and tell me, is the cervix dilated enough for me to do that procedure?
If an abortion is required due to medical emergency, there would be no penalty for that.
LSU legal expert Lisa Avalos says providers found administering abortions for women over 15 weeks pregnant could face up to 15 years imprisonment and a fine ranging between $20,000 and $200,000.
Any abortion prior to 15 weeks gestational age, the penalty is 1 to 10 years in prison and a fine of $10,000 to $100,000.
Avalos says a doctor needs to get a second opinion before intervening if there's a medical emergency.
So things such as an ectopic pregnancy outside of the uterus, those types of procedures are permissible.
What none of us want to see, including people who are pro-life, are women dying.
Professor Avalos also sees one of her biggest concerns is women buying unregulated abortion pills on the internet and the health repercussions they could have. Eleanor Tabone, Eyewitness News.